I would like to welcome everybody. Again, my name is Leanne Foster and I am with the Provider Outreach and Education Specialist here at WPS Government Health Administrators. And again, I'd like to welcome you to our webinar on Hospital Provider Enrollment Basics. We'll start with our disclaimer. Moments ago, you did just notice I had a pause. That was me recording this session. So we are recording this session today for you. So that also means that it will be available on our YouTube channel so that you can watch it again if need be, or you can share it with anyone who was perhaps not able to attend but would find the information helpful. Along with that, I do want to start with our disclaimer that that indicates that the material presented today is accurate as of today. As you all know, Medicare changes often, so please make sure that you're reviewing official CMS communications, which includes the CMS and the WPS-GHA website for the most up-to-date CMS rules and regulations. As I answer questions today, I am answering those questions and the material was presented or created based on current CMS regulations. And finally, CMS does strictly prohibit photographing, screenshotting, or recording of this education for profit-making purposes. As I indicated, we have started the recording on this session, so again, it will be available to you on our YouTube channel as soon as possible after this session. That brings me to our agenda for today. Today, I am going to focus on the basics for enrolling a hospital facility into Medicare. We will be covering inpatient hospital enrollments today. I am also working for future education sessions regarding rural health, federally qualified healthcare centers or FQHCs and critical access hospitals, but they will be out of scope for today. Today, as I said, we are focusing on inpatient hospital enrollments, and this would be hospitals that are billing using the UB04 or the 837I electronic transaction, so those inpatient claims. And during our session today, as I said, basic enrollment functions for hospitals. We're going to talk about eligibilities for hospitals. We're going to define some common subunits for a hospital, and we're going to talk about the overall process. And this isn't just the MAC process, but we're also going to talk about something called the certification and survey process that has to happen in order to enroll most Part A providers. Now, you are going to notice as we go through this as well, one thing before I move forward, there are going to be some significant differences, and the biggest one is going to be that process. I will be pointing out those differences throughout the session today so that it is clear for you. Medicare has a lot of acronyms, and provider enrollment with Medicare is no exception. So for your convenience today, I have included the acronyms that I will be using for today, and I'm going to run through those here quickly. The first one is the CCN. That is the CMS certification number. That is really the same thing as the provider transaction access number, or the PTAN. That is just a different acronym or a different classification that's utilized for Part A providers that is unique to our inpatient facilities. CFR is the Code of Federal Regulations, which governs everything that we do. That's the actual federal law that is Medicare. The IRS, Internal Revenue Service. NPI is the National Plan Identifier, so that's going to be that 10-digit number that you're registering for all of your providers. I will talk through PACOS a little bit today. That is the Provider Enrollment Chain and Ownership System that is utilized to submit enrollment applications electronically to the MACs. One that we don't talk about often is the PIOG, which is the Provider Enrollment and Oversight Group. They are a big part of that certification and survey process that we'll talk about today, and they are the CMS governing body that oversees provider enrollment. I already mentioned PTAN. The PIM is the Program Integrity Manual. You'll hear me talk about Chapter 10 quite a bit. That is the manual that again regulates and provides guidance to everything provider enrollment does. Not only the requirements for enrollment, but also how the MAC processes those applications. So that when we get into that, we'll talk about what is included there that'll be helpful to you. SA is going to be the state agency, and again, we're talking about them as part of that process. And then I will be using one for a provider, which is skilled nursing facility, also known as a SNF or SNF. So we'll start with an overview of the type of facility we're talking about today. As I said, we're talking about hospitals. Hospitals are defined in the PIM 100-8, Chapter 10, Section 10.2.1.8. And this section talks about the requirements of the hospitals, but it also talks about the different possible subunits of a hospital. I've included that link for you in the material today, so you'll have that. It's here, it's also on the resource page. Bailey has also added that to the chat should you want to take care of that or take a look at that, but it really does outline those requirements, and we'll talk about those. Hospital is typically defined as an institution that is providing inpatient care. They will be providing both diagnostic and therapeutic services. A hospital, when they enroll, they must have a provider agreement. We'll talk about that a little bit more. That hospital agreement is going to be the CMS 1561 provider agreement. This is really an agreement between the provider and CMS besides the CMS 855A application, and it has a lot to do with agreeing to certain regulations. There's a link provided in the material today, but that is part of this process. The other thing that I want to point out is that for hospital enrollment, it's a little bit different as far as receiving that CCN number or that PTAN. Again, I'll use those two interchangeably because they're really very similar, and essentially the difference is something is for Part A versus Part B. In the Part B world, the MACs actually assign that PTAN and grant the effective date for the provider. This is one of the larger differences between enrolling somebody on the Part B side and enrolling a hospital or honestly any other Part A provider. That PTAN, that CCN, and effective date are determined by CMS and not the MAC during the enrollment process. Before we go into the process, though, I do want to talk about eligibility. So to be eligible for a hospital, the hospital needs to maintain a state or local license. Now that's going to vary based on where that hospital is located, what type of licensure they're going to need, but they will need to be licensed as a hospital. And that is something that does need to be provided as part of that enrollment application. It is also something that is going to be verified as part of that process. All patients do need to be under a physician's care. So they've been admitted. They also have to provide 24-hour nursing care, and with that nursing care, it must be supervised by a registered professional nurse and have a licensed practical nurse or registered professional nurse on duty at all times. They do have to meet the health and safety requirements for a hospital. This is usually part of that licensure process. They do also have to maintain patient clinical records, and they have to have a hospital utilization review plan. And finally, we're looking for bylaws that are in place for staff and physicians. And it's a lot of different pieces, and they really do all roll up into that license that's received in order to be eligible to enroll as a hospital. So next, I'd like to walk through the enrollment process a little bit. As I mentioned, this is really where hospital enrollments and Part A enrollments in general are very different from Part B. Before I go through this, I do want to call out that this process, they're transitioning some of the steps of this process back to the MACs, simplifying the process a little bit. Not all providers have been transitioned. So some pieces of this may or may not when you get outside of the realm of a hospital. The differences in that process really are dictated by the type. So again, we are focusing on the enrollment process for a Part A hospital. So the first part of it is that the provider needs to complete that CMS 855 application. And we'll talk about that more in a few minutes. But that 855A is submitted to the MAC. From there, what happens is that the MAC is going to review that for completeness. They're going to review that for accuracy. They're going to check all of the names that appear on the application against various watch lists and websites. They're going to ensure that they have all documentation that's required to enroll as a hospital. And if they find that there are discrepancies or missing something, the MAC is going to send out a development request to the provider. And this all happens on this initial review. That 855A submission continues, or that verification process, it doesn't move on to the next step. I shouldn't say that, past MAC review, until we have received everything that we need to do what's called recommending approval to the state agency and to CMS for enrollment. So the provider has to meet all enrollment requirements before the state agency or CMS will get that recommendation. So once we have all of that, then the MAC will send any necessary documentation, the application, the approval recommend letter to the state agency for them to start their certification and survey process. Now, as a provider, the provider is going to get a copy of that approval recommend letter. So you're going to know that that review has been complete. As far as the MAC is concerned, the provider meets all of the qualifications to enroll as a hospital, and then we're moving it on to the next level. At this point, the provider does not have, it's an approval recommend, so the provider does not have a CCN or a PTAN, they don't have a Medicare number, and they do not have an effective date yet. That is all something that is still in process. Once the state agency has completed their process, and unfortunately there's not a specific timeline for that process, I have seen where that can be quite a lengthy process. It has a lot to do with what type of surveys, what has to go into the certification, and that absolutely varies by the type of provider. And that is something that the MAC is not in control of. You will get a resource further down in the resource section of today's material that does actually take you out to the state agency's operations manual, which can offer some insight into that. But that process is really controlled by the state agency and not the MAC. That application will result in an enrollment record being created in our PAYCO system, but it's not finalized. Everything's there but that PTAN and that effective date. And it kind of sits in a holding pattern until we receive a response from the state. Now, there's a couple of different responses that we could get from the state. The state's going to come back and they're going to inform us of their decision. Ideally, they're going to tell us, yep, they agree with us, go ahead and prove it, and it'll move on to the next step, which we'll talk about in a minute. The state could come back and say that there's some type of a deficiency in the material that was provided and that we need to develop. And then we will further develop to the provider. Or they could come back and say that the certification and survey process was failed and we would deny the application. Most oftentimes, in my experience with provider enrollment, most oftentimes it's either they're being approved or there's some type of development that has to happen. But again, if there's development, you want to respond timely. That development piece can hold up that process, and we don't want to do that. So when we ultimately get the approval from the state, the MAC then sends that to the PAG. So at this point, we are sending it to CMS. At this point, the MAC has all of the information that CMS needs in order to create that CCN or that PTAN number. The state agency has agreed. They've completed any survey and certification activities that are required. So by the time it gets to the PIAG, it is ready to go. At that point, CMS is enacting or activating that provider agreement, and they will approve that application. Once they have approved that, they do send it back to the MAC. And they send it back to the MAC with the CCN or PTN. Again, same thing, they just a little bit different for Part A. That's CCN and the effective date that CMS has approved. So it's not necessarily going to have to do with the effective date the provider has listed for practice locations. They can vary. Again, a lot of it has to do with the outcome of that survey and certification process. But at that point, once we get approval from CMS with that CCN and that effective date, the MAC will complete the enrollment, the skeletal enrollment that they have built. They will attach the CCN number, they will attach that effective date, and they will approve that enrollment. And from there, the provider will receive notification, and then they are set to bill. So the next thing I want to talk about is that enrollment form and that enrollment process. But I want to check in with Bailey. Bailey, do we have any questions in the chat yet?
No questions yet.
All right, thank you. So we're moving on to submitting the application. Now, before we start, I do want to clarify one thing. I am talking about hospitals that are enrolling to bill on a UB04 or an 837I electronic transaction, so the inpatient services. I do want to point out, though, that hospitals can enroll to bill Medicare Part B for physician and non-physician practitioners. Hospitals are not able to do that through Part A. So if a hospital needs to enroll, say, their departments, they have to enroll for their emergency room doctors, or perhaps they have a clinic, they need to enroll that. Anything for those labs, if they're doing professional services there for readings, various departments, they can do so, but they would do so on an 855B, they would get a group P10, and they would also need to submit an 855I for the members that are coming in. So we're not going through that piece of the process. What I am focusing on is that CMS 855A for services that are going to be billed to the Part A side. So there's two ways to submit these applications. First is going to be PACOS. This is the only way to submit an application electronically to a MAC. I'm always going to promote the use of PACOS, especially with PACOS 2 coming in. This is always going to be your most efficient way to submit an application. You can fill it out, you can see it, you will get status updates through the system. You can, once the enrollment is built in the system, you can see that information. It's a little easier to monitor things. And after you've been established, you start talking about needing to do changes or revalidation. It's much simpler to do that in PACOS because all of the information is there. So for PACOS, though, you would need to get a user ID and password and make connections with your organization. All of that is pretty simple and straightforward. We do have some YouTube videos available on our website and some encores that go through some of that. So I do recommend, if you're going to submit want to submit electronically, you take a look at that. The other option is through the paper CMS 855A. Now, the paper CMS 855A is available on CMS's website, and the materials do include a link to that paper application for you today. On the CMS website, though, when you pull this up, it's an electronic template. So there are fields that you can fill out. In fact, it has to be typed. It cannot be handwritten. If it's handwritten, it will be returned. So you will fill it out, but then you do need to save it, download it, print it, have it signed, and then it's going to need to physically be mailed to the MAC. Now, processing time, just by virtue of this needing to be physically mailed to the MAC, just the MAC screening, that MAC review is going to take longer. Typically, a web application is reviewed within 15 days, provided we don't have any development on it, and a paper application takes 30. And that is calendar days, not business days. And that is because, with the paper applications, that is because of that process to get it mailed to us. We need to get that opened. We need to get that scanned in. It needs to get into our workload and then into that process. So web applications are also always given priority. Pardon me, and a tickle in my throat. So moving on to the required sections. As I go through this, you are going to notice that I'm going to do a side-by-side comparison with the PACO section versus the CMS 855A paper application. So you can see those similarities, and so we can talk through those sections. I'm not going to be going through field by field. The CMS 855A application in PACOS will walk you through it. We did also recently do a webinar on the paper CMS 855A application. CMS did just change that a little bit, and a link is going to go into the chat for that video. It looks like it's already there. So if you're interested in those changes largely consisted of wording changes. So they did some wording changes for clarification. They restructured the application a little bit, streamlining it, and actually made it a little bit more logical. They reorganized pieces where they really probably should have been before. So that overall flow and the consistency of it have been improved. Now, there was one section, there have been some fields added, and that is for section 10. That's a new section, and it's for opioid personnel. So if you're trying to open up an opioid treatment program, there is a section that is just asking for the prescribing and the dispensing personnel. Otherwise, the CMS 855A is largely unchanged. And I say that because the changes were, again, for consistency and consolidation of sections, just to make it a little bit more user-friendly. You're not necessarily going to see those changes in PACOS until the implementation of PACOS 2.0. So, and that is because that is such a big rebuild. They're just holding off on those changes. And PACOS 2.0 is expected to be implemented sometime this year, so it shouldn't be terribly long. I just want everyone to be aware of that, because you might notice that the flow is a little bit different when you're in PACOS. But all of the sections are there. The application has what it needs. Max will not develop for the wording changes that are there, or if a field is in a slightly different place, Max will not develop for that. The one thing they will develop for, and have to, is Section 10 for opioid personnel, and that is simply because that information does not exist in PACOS yet. So we'll start with the required sections, and what you're seeing here is an image on the left of the questionnaire that starts as soon as you tell PACOS that you want to start an application, or if you're going into an existing provider, you'll see this as well. This is your application type, or your scenario, basically. So you need to tell PACOS what you're trying to do. The way PACOS works, if you're not familiar, it's not, I always kind of compare it to tax software. It's that time of the year you're submitting your taxes. If you happen to be doing it yourself using one of those pieces of software, this is kind of similar. You answer questions about your provider, and it presents you with the required fields and questions that you need to answer in order to complete that enrollment. So here what you're seeing is the selection of create an initial enrollment application has been selected. You would use this if you're brand new to Medicare, your facility is brand new to Medicare, or you have a facility that previously was always enrolled in Part B, and now you want to enroll the hospital and inpatient, or you have a facility that was maybe enrolled in, I'm just going to say Texas, and now they're enrolling in Michigan. Technically, it's still an initial enrollment for that jurisdictional state. So that will then tell the system, okay, I've got to ask you a couple of more questions, and we'll get to those in a second. On the right side, you're looking at that paper 855A. That paper 855A is going to give you the same options. That first option is you are a new enrollee. That is going to tell you what sections to complete, and basically it's every section. There are exceptions on the 855A, and it's excluding section 2G, 2H, and 2J, and you'll see there, excuse me, an I, and you'll see that a lot. And what that is, those three sections are for changes of ownership, acquisitions and mergers and consolidations. So if you're an initial enrollment, those are obviously not going to apply. You do not need to include those sections if you're mailing that in, you're doing regular mail. You only need to include the sections that you completed. And also one tidbit with the 855A, instructional pages that we didn't ask you to complete anything on, those do not need to be included when they're sent in. So again, if you're physically mailing this, save yourself a little bit on the postage. Part A applications with all of their documentation can sometimes get lengthy. So the next question that you're going to see is going to be the type of provider. So on the left, you are seeing the type of provider with all of the hospital units. So as when some of those questions, your initial enrollment, it asks you to select your specialty, and you're going to tell PACOS, for this scenario, I'm a hospital. And then you'll get asked about hospital subgroups. And any of the specialties or the subgroups listed, provider types listed on that PACOS, it's also listed on the paper image that you're looking at the right, those can be what's referred to as a subunit of the hospital and can be reported on the same application as the parent hospital. Okay. On the paper side, you're going to see a little bit easier that there's a difference between hospitals and non-hospitals. One thing I want to point out is in section 2A1, you will see type of provider, and you'll see things like community mental health, you'll see critical access, you'll see home health agencies, hospice, you'll see the opioid treatment center. Anything that's listed there would be listed underneath the specialty question in PACOS, and those specialties, those provider types, require their own CMS 855A application and cannot be a subunit of a hospital. The question 2A2, you've told us it's a hospital, and then you're going to select any subgroups. So you'd select hospital because it is a hospital, but then you can select any subgroups underneath that. So that's the kind of that bright line of who can be a subgroup and who can't. Take a look at this section, or in PACOS where it lists hospital dash, and then it gives that subgroup special or subgroup type. Now there's an additional question, and this is something that will not be reorganized in PACOS until PACOS 2.0. It's questions 3 and 4. On the paper application, they're right there with the provider type. They used to be elsewhere. Again, continuity is just making that flow a little bit better. The first question, it's saying that if you checked hospital, okay, in section 2A, it wants to know if the hospital has a compliance plan that is indicating the hospital is going to check all managing employees against exclusion and debarment lists for both Health and Human Services Office, I shouldn't say both, Health and Human Services Office, the Office of Inspector General or OIG, and the General Services Administration or GSA for any exclusions, debarment, or any flags that may preclude that person from being part of that organization or may need a second level review. Just because somebody is on one of these lists doesn't necessarily mean they can't be part of that organization, but they may also need, we may need CMS's approval to include them. So that's what that's asking. And it's just a yes or no question. Question 2A4, this is asking about whether or not the hospital is physician owned. Something about physician owned, they're pretty rare. In fact, there used to be a physician owned hospital form that CMS is no longer requesting. but we do need the question answered. So just something that's easy to forget, you want to make sure it's there. Again, in PACOS, it is going to ask you this question. It's just a little bit further down because PACOS hasn't been reorganized just yet. So I mentioned subunits, so we're going to take a look at those. At its base, a subunit is a unit within the hospital. They are established to provide services other than those offered by the parent. Like I said, it could be some type of a clinic. It could be a psychiatric unit. It could be a swing bed unit, which is a unit that has beds that can switch between regular hospital service and a skilled nursing facility in the event that it's needed. Those types of things, those are subunits. However, it is important to know that they are not considered a separate provider type. Like we just talked about, you kind of want to look at that section 2A, question 1 and 2 on the paper form if you're looking for that paper reference, but it'll talk about which types of units can be those subunits versus those that have to be a separate provider type and enroll on a separate 855A. One of the most common examples of that is going to be a critical access hospital. Critical access hospital cannot be a subunit of a hospital. So subunits, again, they're going to be part of that parent hospital. They are going to share that same tax ID. If they have a different tax ID, they are no longer considered a subunit. They are their own entity, even if they are one of those qualifying subgroup types, and they will need to enroll on their own 855A. Now, if they're qualifying as a subunit, they can be listed on the CMS 855A as a practice location. It is possible that they are going to get their own, or likely they're going to get their own CCN, but you don't need a separate application to enroll them because they are technically a subunit. And during that certain survey process, the state agencies and CMS will see that and be able to issue those. So it's not necessarily uncommon for one CMS 855A to result in multiple CCNs. Now, as far as the provider agreement, and here you'll see I have a link to that CMS 1561, which is the, when we say provider agreement, this is what we're referring to. A subunit may share the same provider agreement, or they may have a separate provider agreement. They can still be a subunit. There are some there's logic that goes into assigning those CCNs that will tell us whether or not they share that same provider agreement. And one of the big things here that this impacts is revalidation. So if you have a subunit that shares the same provider agreement, they can revalidate on the same CMS 855A form if they're up for revalidation at the same time. If they have a separate provider agreement, they're going to have to revalidate separately. And again, that is not something that is determined by the MAC. That is something that's part of that certification and survey process. Subunits may and often do have separate MPIs. So that is not uncommon, but that is going to need to be listed in the application practice location section. And then those CCNs, typically the parent hospital is going to have an all numeric CCN or provider number, that PTIN. Your subunits are typically going to be alphanumeric and include part of the parent's CCN. And so that's just really an identifier. And again, that is something that's not controlled by the MAC, that's controlled by CMS. So, but it's an awareness piece so that you can tell a little bit about that CCN just visually. There are some exceptions to subunits. So like I keep saying, separate provider types. So if you have a hospital that's also operating as end-stage renal disease facility, those are separate applications. I mentioned the critical access hospitals. Typically SNFs cannot be a subunit. However, with that swing bed, it is possible for a hospital to have one skilled nursing facility as a subunit. So moving on to the practice location section of the application. This is a piece where there's a couple of things that we need to generally be aware of. So first, you do need to list all locations that are owned and operated by the hospital. So all locations. You do need to uh, indicate which location is your primary practice location. There is a box indicating that, and you'll see that highlighted in green here. You want to make sure that you indicate that. You do want to make sure you list that first. If you have multiple and you're sending it in paper, make sure that primary is the first one. That's something that we'll look at as the main location, and that's super important for that certification and survey process. It's also so that we know that is the parent hospital if there are subunits. So you want to make sure that we have all of that. You do need to identify the type of location. So you'll see that inset, you need to let us know what. Is it a swing unit? Is this a psychiatric unit? There are certain types of subunits that we need identified. So this is just something that you would need to take a look at. The longer list on the right in that paper section, and again, this will be presented to you in PACOS, that is going to be for outpatient provider-based departments. And you would have to select the definition that most accurately applies. You will notice that there are CFR references there to help you along your way. So hospital documentation that's required, as I mentioned, you want to make sure that you're providing that hospital license. If not, it is something that we will develop for. If your hospital has an accreditation, that is something you definitely want to report on the application and something that you want to provide a copy of. That is something that is verified and can speed along that survey and certification process. It can actually be used in lieu of that survey in some circumstances. And it has to do with the fact that there's a survey that happens as part of getting that accreditation. So if you have that, make sure that you include that. Obviously, we're going to need tax ID verification from the IRS. Typically, what we see on the Part A side is the CP 575, or in the case of a nonprofit, a 501c3. That 501c3 is just the letter that you get and use to prove and notifying you of that nonprofit status. For Part A, we do need a copy of an organizational flowchart. So any of the ownership that's listed in sections 5, 6, we're going to need that organizational flowchart. Now, along with that, it doesn't need to be on the flowchart, but this is a little bit of a tip. That ownership section is going to ask for percentage of ownership, and that's for all direct and indirect owners. All direct and indirect owners need to be represented on this flow chart as well. That is something that during COVID was a flexibility and a waiver that has been allowed to lapse. So we are requesting that organizational flow chart again. So if you've submitted hospital applications in the past and weren't asked for that, that is something that has been reinstated. We are asking for that again. You will need to include a CMS 588 or electronic funds transfer agreement. Now, if you're submitting electronically in PACOS, this can be done in PACOS and signed in PACOS. This is what allows us to make payments electronically. So it has bank information, account information, routing information, the name on the account, that type of information. One thing I do want to point out, if you are not signing it electronically in PACOS and you're wanting to upload a paper signature, you have to do one of two things. You either have to use the printed PACOS certification statement. If you select upload, the system will give you that document, or you have to upload the entire CMS 588 paper form completed. That is a CMS directive. They will not allow us to just accept the signature page from the paper CMS 588. They want the information attached to that signature. So I highly recommend leveraging those electronic signatures when you can. I know with authorized and delegated official, that can take a little bit longer because you'll indicate who, an email will go out to that person, and they'll have to sign in to electronically sign it. And I do realize that that is one of the reasons people will sometimes default to uploading that paper signature, but I don't want you to get caught into any kind of development for that. And that is again where just the signature page from that 588 won't suffice. CMS requires us, if you're attaching the 588, it's got to be the whole thing. The other thing I want to point out on that 588 is if verify the information that's in there against your account verification documents. So voided check, bank letter that's signed, make sure you're including all of that. If anything has to be changed on a 588, we can't just accept the change on that form. We have to get an entire copy of that CMS 588. And then other documentation you're going to want to include is going to be that adverse legal action documentation, if anybody has anything to report. So before I get to another segment for questions, I see we've got at least one in the chat. I do want to just offer some tips. One is going to be make sure you have all your documentation together. That accreditation, again, if you don't have it, you don't have it. But if you have it, please include that, because that can definitely be something that can help speed up that enrollment process. Also, submitting your applications through PACOS and submitting electronically. It speeds up the MAC review portion of it. That's certification and survey process can be lengthy, so you want to submit information as efficiently as possible where you can. Also, just kind of keep in mind, again, that CCN, that PTAN, that effective date is assigned by CMS, and you are going to get a letter telling you that approval was recommended before you actually get the approval, right? And then lastly, make sure you're responding to development requests fully and timely, because again, that's something that can delay the process of getting it to that state agency and in turn CMS to get your CCN and effective dates changed. One other thing I do want to mention about that that certification and survey process, it definitely impacts all initial enrollments. It doesn't necessarily impact everything that happens after that. Revalidations, as long as there aren't changes to that main location, typically revalidations go through pretty quickly. They don't require that, that certification and survey. If there's a change of ownership, which is an instance where one entity is buying another, you could be impacted by that certification. You will be impacted by that certification survey process. And if you're making changes to a main location for a hospital, that is going to potentially require another certification and survey. So those are things to keep in mind. To wrap up before questions, I have included some additional resources for you. I did include a link to the PIM, that chapter 10 for hospitals and hospital units. I did include, and I apologize, there is a typo on this slide, a link to the state operations manual. That's chapter 2. So that is going to be specific to hospitals, and it'll walk you through that certain certificate, or we call it certain survey process, that certification and survey process, so that you can know what to expect and what they're looking for. There's also some information regarding the definition of a hospital and provider agreements in the Medicare General Information Eligibility and Entitlement Manual, Chapter 5. So I've included that. On our WPSGHA website, we do have some resources available. So there are the becoming an institutional provider. That's actually a CMS link, my apologies. As well as the hospital center. And that's going to include links to a lot of the resources that we talked about today. It's going to include links to the forms, as well as, and this is the WPSGHA, the hospital enrollment page. That's going to link you to multiple CMS resources, checklists, things that'll help you with that enrollment process. With that, I'm going to check in with Bailey. Do we have any questions in the chat?
Yes, we have one, and it is, can you speak to Method 2 provider enrollment on the 855A?
I can. So method 2 provider enrollment, it's typically just critical access hospitals, and the enrollment process is really the same. Let me take you out to, this is our GHA website. Can't spell critical. There is a really good resource out here that I'm going to put in the chat. So for critical access hospitals, there is the general hospital criteria that they have to meet, and it's that method 2 piece that I want to put out here as well. Basically with method 2, I'm distilling it way down, but with method 2, they are actually allowed to bill for their professional services, but their providers need to be in PACOS. So what happens is that critical access hospital is going to enroll normally. And then there's that method 1 and method 2 link. And this will cover their payments, whether they're method 1 or method 2. Okay. It does talk about electing method 2 for the first time. Again, you're still going to enroll as that critical access, but you are going to need to essentially submit in writing that you're wanting to elect to be method 2. This will include the information of where you can send that to. But then what happens is your members, and I'm calling them group members, it's kind of more of a Part A term, or excuse me, Part B terminology, but your members have to be affiliated with your Part A facility. And to do that, to enroll those members, if you're billing method 2, they have to submit a CMS 855 application for themselves. So it's going to feel and it's going to look like they're enrolling to bill on the Part B side. Rest assured they're not. What's going to happen is that application is going to come in, provider enrollment's going to review it just like a Part B application, but the entity that you list in section 4F for the reassignment of benefits is going to be your Part A facility. And again, this is cause. So critical access hospitals. That is going to be set up in PACOS that way. You're going to get an approval letter for those members that you can start billing method 2 for them. However, you're going to notice on the letters, they are not assigned a PTAN. So this is the one enrollment that we do outside of an ordering referring situation that we are actually giving a provider the ability to bill without a PTAN because they're going to be reported on that facility's UB04 or 837I transaction. I'm just looking at the chat. I just saw this, Bailey. Sorry. I was told you cannot link PAs to method 2. Is there a way around that? Unfortunately, at this time, no. CMS does list the providers that can bill for method 2, and at this time, PAs are not part of that. So it's typically your MDs, your DOs, nurse practitioners, nurse midwives, nurse specialists, social workers, clinical psychologists, the new mental health specialties of marriage and family therapists, and mental health counselors. But at this time, physician assistants have not been added to that list. So that ends our presentation for today. On behalf of myself, Bailey, and everyone on the GHA Provider Outreach and Education team, I would like to sincerely thank you for taking the time to attend today. We look forward to those survey comments, and again, please be sure to include topics you'd like to see in the future. Again, thank you all. You may now disconnect.